As the blade approaches the cornea, you have to lift it slightly because you've got another complexity is you've got the curve at the limbus, right? So the sclera is at this angle, the cornea is at this angle, and the limbal junction has a change in direction. But the blade is straight. So how do you compensate for that? Well, you change the shape of the eye is how you compensate for that. You can't change the shape of the blade, but if you lift the tip slightly, it straightens the limbus out. And then you can proceed with your dissection in one plane, because that's all the blade will do. You can't change the angle of the blade. You can't change the shape of the blade. Any tips you would add, David?
I would just make a comment on the variation of scleral anatomy.
Oh, great point.
That many times it might correlate with what you might expect to a 100-year-old, 40-kilo little old lady with blue hair. She probably does have a very thin sclera, but it doesn't always correlate that way. And really, you get a feel for that as you're making the peritomy. You get a little feel for that as you're doing your cautery, but you really know where you are when that crescent blade hits the sclera. Yep. And so that first pass, and you saw Glenn, that was your hand doing that, I think.
Yes.
Do it very efficiently in a couple of passes. He's got a lot of experience in the pressure of what it feels like, and as he talks about some of his current work, it's interesting to hear the engineering data that he has on all that. But basically, when the blade hits the sclera, you're finding out what is the sclera going to give me, because I agree, I do 50 to 67% depth. A little bit thicker at the lip. I call that the lip. I want a good solid lip. If I have a solid lip from stem to stern, from left to right, even if I go thin or thick from there on, I can manage that. But you really don't know that until the blade hits the sclera.
Let me just summarize that. That David said you want a great you want a good thick lip where you've made the scleral groove. So that it gives you places to hold on. It avoids shredding it later in the procedure. I mean, there's all sorts of good reason to have a nice thick lip there. And secondly, use every time you touch the patient's eye, you learn something about that eye. So, for example, he was mentioning the crescent blade tells you something about the texture, the thickness of the sclera. What about when you first touch the eye with the Colibri forceps? What do you learn? You learn the pressure. Exactly right. So you know if that eye is excessively soft, you're going to have to push a little bit harder because it's hard to cut consistently against a soft eye. So you've got to raise the pressure a little bit more by pressing with the left hand. So this is a two-handed procedure, actually, not one-handed. And that means the two hands have to work together. The left hand is sensing things like pressure and position. The right hand is moving and creating. I've shown you can actually cut the whole groove with the left hand. Holding the right hand, the crescent blade still, I can cut a groove by moving the eye with my left hand. But that's because it's a two-handed procedure. That's the only point of that. I would never do that routinely, but it's just to illustrate that this technique is a two-handed procedure. And you use both hands to get data into your head about that patient's eye, right? That's a great point. The crescent blade, you can use the crescent blade to get a sense of the width of the tunnel because the crescent blade is about 6.5 millimeters from here to here, from there to there is about 6.5 millimeters. So if you want a 3.5 millimeter wide tunnel at the center point, if you go about half the width of half the length of the crescent blade, you've got a good marker on how far you want it to go. To complete the dissection, I'll show you the dissection all in one video clip rather than each at a part. It's too quick and it's hard to put it all together in your head, so that's why I think it's best to look at it all at once. So you stabilize the eye by grasping the cut edge of the tunnel. There are those that would gasp at that you'd never cut, you never grab a cut part of the eye, you never do that. But Dave just made a big point about making a good thick scleral groove edge. I don't know if he grabs that edge or he does grab that. Okay, I wondered if you did when you said that. Because I tell you, there is no better way to stabilize the eye, and you're putting the most extreme forces on the eye occur during the tunnel dissection. Or that's the only point it should be extreme at all. And then by extreme, I mean it's about 10 times more force that's being applied to the sclera at that point than at any other point during the operation. It's still not a lot of force, but it's considerably more at that point in the operation than any other point. You need good stabilization. A bridle suture won't do it. That won't help you at all with this. The eye will still roll around if you have a bridle suture in. I've watched that happen to a lot of people. So you need something good to hold on. I recommend holding onto the cut edge of the tunnel. Swing the heel of the crescent blade in the direction of the intended dissection. This is counterintuitive, but the idea here is that when you slice your steak, no one slices their steak by just laying the blade down on top and pushing as hard as they can, do they? No, it will not work very well. If you push your blade, your knife down on the top of the steak, you will not be eating any steak for a while. You know, it's just not going to happen. So what do you need to do? It's the movement of the knife against the steak that makes the cutting happen, correct? Well, it's exactly the same with this. And to minimize the force on the cut, if you swing the heel of the crescent blade out, the only part of the blade that's cutting starts right here, and then it progresses up the side of the blade to finish. Then you do it again. You start with all the force here at this corner, and then it progresses up the side of the blade. So you slice like so. If you slice this way, you're increasing the force because now the whole blade is cutting all at the same time, all the time. And it'll work, but it takes a lot more force. And what happens when the force is higher? Control goes down. So you want to maximize control by minimizing the force that it requires to cut. And the best way I've found to do that is by swinging the blade out, because then only a small part of the blade is cutting at any one time. As you slide to the right, so you turn the heel out to the right. As you cut to the left, it feels awkward because you've got to get your wrist over and turn with your fingers, and you slice to the left. And I'll show you that in just a minute. So that helps you avoid excessive force. So then, but to finish the tunnel, so now you've sliced out to the edge of the groove, you still have to turn the blade out to finish the tunnel. But because there's only a little corner left, now there's still not a lot of force to do that. Now when you swing the blade out to the side, now it's just a small amount of force to finish the cut off to the side. And I'll show you that in slow motion in just a minute. Make sure you follow the scleral groove. So that's the end of the scleral groove right there. And you can see the blade, the heel is turned out to the side. The tip is angled towards the center. So it's not angled this way, it's angled this way. And I stop right there at that corner, and now I'm ready to complete this little corner of tissue is still uncut, but it's just that little corner that's left. And so it minimizes the force, like so. So now I can pivot it outward to finish it. Notice that I can just barely see the edge of the crescent blade. It's kind of lined up with the limbus here. That tells you that the angle is about right when you're lined up with the limbus at the side. Any questions about that? On the left side, use the other corner of the scleral groove. You can see it now, it's still pointed, so I've got this uncut corner right here. And I'll finish that, turning it out. One other thing, what do you notice about the position of the crescent relative to the curve of the radius of the sclera? What do you notice about that? Huh? Yes, you've got it. So there's three curves you have to pay attention to. There's the curve that's happening this way. There's the curve that's happening this way, and then there's the scleral curve that's this way. So this tunnel thing really is the most complex part of the procedure, and it's not hard to see what it's supposed to look like, but producing that shape when you have all those curvatures to deal with is why it takes a little practice to get used to it. But again, a good thing about this is that it's not unlike peeling a grape. That all those curves are the same curves you find on a round piece of fruit, like a grape. So if you can peel a grape and follow the curves on a grape, that helps you learn this same pattern for the eye.